Dr. Sandhu, thank you so much for coming on the channel. We have known each other for a long time. You were my senior
Hmm.
resident back in our residency days. And I remember taking overnight calls with you and always had a great time learning from you and just kind of being an intern under your care as a senior. So I'm really excited to have you today. And so maybe as we get into the conversation, you can tell the audience a bit about your background and what you do.
Yeah. So thanks, Nishi. I appreciate you allowing me to be on your amazing platform. I love your YouTube channel and I love what you're doing. I think it's wonderful. So, Nishi and I have known each other since like early 2000, and we were talking 2008. I actually grew up in the UK and finished my training in 2002 and kind of went to Australia, decided to do USMLEs and came to the States in 2005 and ended up doing residency at Henry Ford, ended up doing fellowship in nephrology, critical care. And then obviously I met Nishi in between in our crazy residency days. And then because I kind of had to do a G1 waiver in North Dakota. And then we ended up coming to Virginia. I met my husband and kind of settled down here. I don't do critical care. It's just hard with got two young daughters, and my youngest is 6. So just something needed to change just for balance. And here we are.
Well, it's quite a journey, and it's amazing how medicine kind of takes us all over the place to unexpected locations. So I wanted to focus today a bit on hydration and electrolytes and the relationship with sleep. As a nephrologist and the developer of this product called Dr. Raindrop, you were the perfect person to come on to speak about this. So, for anyone who hasn't heard of Dr. Raindrop, could you tell us what that is and how did you come about developing that?
So in 2023, obviously we do a lot I'm a nephrologist, so electrolytes are kind of jam, but I've never really tried any electrolyte supplements. And in 2023, in January of 2023, I ended up getting COVID and then developed pneumonia and just kind of like a prolonged, like refractory to numerous antibiotics, ended up having to see an infectious disease doctor, a cancer workup, and just it was because I was losing weight. And finally, after some big gun antibiotics, things cleared up. But then I developed POTS. So I started having issues with low blood pressure and high pulse rate and just feeling I passed out a couple of times, wore 2 compression stockings, tried electrolyte powders because you still have to go to work. And a lot of them, I just didn't like the ingredients. A lot of them were made with kind of like table salt, didn't really have electrolytes. I was having a lot of issues with cramps, muscle fatigue. And so this led me to make my own. So that's where Dr. Raindrop, rain hydration. I love rain. I love the outdoors. And because it has minerals and electrolytes, we came up with Dr. Raindrop.
For anyone who's not familiar, could you explain how it works? So it's a powder.
It's a powder that you mix in water. So I think it's something you can use like a lot of times we wake up in the morning and we're dehydrated just because we've pretty much fasted for whenever you last ate type of thing. And it's good for on the go, pre, post workout. And it's got electrolytes with magnesium, potassium. We've got pink Himalayan sea salt in there for the sodium chloride portion of it. We have minerals in there too with magnesium glycinate and just a lot of things in its pro form so it can be absorbed, and a lot of good vitamin B vitamins in their pro forms as well that you can actually absorb. And nothing's 100%, which was really important to me. And because I was going through this, I also had an immune complex in there. So the immune stuff was like a little bit of elderberry, the selenium, and the zinc. And it was really important for me to make sure it was tested because I didn't want erythritol. I didn't want it to be high in sugar. I also wanted it to be like gluten friendly, soy free, etc. So it took a little bit of time, and we have it in 2 flavors right now. And we just launched this. It's been a year actually, and we have it on Amazon just because with work, people want their items the next day, and you just can't do that. when you batch it up.
It's great that you developed this because, again, as a nephrologist, you have specialized knowledge when it comes to electrolytes and you know what people need and what's safe.
Right.
Because I think there's so many products out there that people are taking, they may not have any guidance around what's appropriate for them.
I know. I think the supplement industry is it's very unregulated. And I think for us, it was very important to develop something that you can absorb that actually does help with muscle recovery and just general well-being. I mean, the whole thing is to have something designed to make you feel good.
Let's jump into sleep a little bit. And when it comes to patients with sleep complaints, what are some common electrolyte imbalances that you might see or that clinicians should be on the lookout for?
We're in a world where like we have a lot of nutrient deficiencies because a lot of us don't really know how to eat anymore. The average American is holding 1 to 2 jobs. It's a fast pace of life. So it's quick and easy. A lot of people are eating in their cars. We're really not having actual deliberate time to eat and really be mindful of what we're eating. And then other things are like a lot of people are on medications that do deplete electrolytes. Given a typical diabetic patient is on several medications that can definitely cause issues with potassium and magnesium. Then you have like people who are on immunosuppressants, people who've got heart failure, or people who have to be on a water pill for whatever reason, whether it's for kidney stones or something more elaborate or part blood pressure control. Majority of them will have issues with potassium and these and things like just one in particular. We'll start with magnesium. I think the problem with these things is there's like anything that wakes you up at night is going to cause sleep disturbance. So I think if you're having issues like muscle cramps, which sometimes can appear like restless legs, as well. And a lot of people will have actual cramping. I mean, that's going to take a minute. A lot of times the magnesium and the potassium work synergistically. So if you're deficient in one, you're normally deficient in the second one. And then hormonally, things like magnesium and potassium are really important in cortisol regulation. So if you've got high cortisol, you're going to have that amped up effect. And then magnesium is really important with melatonin as well. There is some data to suggest that it does support or help indirectly with melatonin production. And then blood pressure regulation is vital in sleep. We have this phenomena called dipping when we're sleeping. Dipping is really important. Our blood pressure falls when we sleep in healthy subjects. That is really important because if you don't have that, you're more predisposed to having cardiovascular disease. So, and magnesium is also really important in just for diabetics for their glucose control. And then you have issues like when you are magnesium deficient, you correct me as well, you definitely have blockage of the NMDA receptors and you tend to be more excitable, I think, before bedtime. So I think just anything that helps with GABA promotion, that really does help with relaxation. A lot of times when you are deficient in electrolytes like sodium, potassium, and magnesium, you do get like fatigued and irritable, and that just where general well-being is low. And I've seen a lot of patients when they have electrolyte issues, particularly with magnesium and potassium, they have a lot of anxiety because their heart rate is elevated, or they just feel, and you get mislabeled as having anxiety, and this label never leaves, particularly if you're a female. So they're like, I'm having a panic attack, and it's actually their magnesium levels are low or their potassium is low, and they just feel so tired and they can't sleep well. So it is important in that whole, it's very important in sleep, but it comes from different angles, really.
That's so helpful. And I think it's a great reminder as to how much nutrition and electrolyte balance and these foundational things have an impact on mood, cognition, energy, physical health,
Yeah.
and overall health.
Yeah. Yeah, for sure. I mean, I think it's something that we don't look at much. We just We just are like, you just need to sleep more. You gotta, and sleep hygiene is important, but there's also once people have addressed different issues with just more sustained sleep, you have to look at that. And particularly if you're getting up, I think anything that will wake you up is going to cause sleep disturbances.
Absolutely. And so you've spoken about magnesium, potassium as being sort of very crucial electrolytes.
Yeah,
You
yeah.
mentioned sodium as well. So for the physicians, should they be checking those levels in their patients if they are complaining of some of the symptoms you just described? And if so, what's the best way to check those levels?
I mean, just a lab test will be good. Just checking sodium, magnesium, potassium, and phosphorus, I would add too, because they kind of work together. And I think people that are at particular risk, say your transplant patients or patients where more patients are on immunosuppressant agents, people are living longer, more people are on diuretics and water pill type of medications is common. And then your asthmatics who are on inhalers, a lot of them have potassium, magnesium deficiencies too. And then people who you feel like the other thing that's really important, but kind of, I think there is a push to look at this or check it more is B vitamins as well. There's a lot of patients that are not getting B vitamins because there's a lot of patients that are vegans or they're not getting the B vitamins in their correct form, so they're just not absorbing it.
That's really helpful. And are there optimal ranges we should be looking for?
Yes. I mean, typically for potassium, if someone's having cramping, you really want it around 4. And the magnesium, 1.8 is a lower range. But if you have issues with like atrial fibrillation or cardiac issues, it should be closer to 2. And then sodium's a difficult one because it's regulated. There's so many different things that regulate it. And as we get older, and particularly females that are going through perimenopause, menopause with hormone shifting, a lot of times you have different ADH, not different, you get less ADH secretion. So a lot of times in elderly patients, their sodiums are never going to be, they're just going to be on the lower end of normal type of thing. It's never going to be close to, I'm not saying never, but a lot of them, especially when we're hitting above 80, you get a phenomenon called reset osmostat, and the sodium is, and this is an ADH kind of mechanism partly, it kind of is on the lower end.
And how about B12? What's your sort of optimal?
I mean, B12 is a difficult one because I mean, that's hard because each hospital has its own variation, but you want someone, at least if it's very low, then obviously B12 shots are appropriate. But if someone is able to take oral, you want something in the methylcobalamin form rather than just like a B12 because you're not really going to absorb it. You'll just end up peeing it out essentially.
As you can see, there's a lot to learn when it comes to clinical sleep medicine, and we're just scratching the surface in today's interview. If you are a physician or a health practitioner who wants to learn more about clinical sleep medicine in a practical way that you can use in your everyday clinical work, then get my free sleep mini course. I'll put the link to that in the video description below. You can also get it at intrabalance.com/doctors. That kind of leads me to the next question, which is about getting your electrolytes from diet versus using a supplement or a powder like Dr. Raindrop. Because a lot of patients will ask me about that. Well, I eat a balanced diet, but we'll
Mm-hmm.
still find that they may have magnesium insufficiency or B12 or
Right.
other mineral insufficiencies. So you sort of mentioned that earlier, but maybe we could speak a bit more about that. Even if
Yeah.
eating a balanced diet, why might they not be getting enough of these nutrients?
So I think balanced diet really depends. It's variable, right? Like for example, 50% of people do not really take in adequate magnesium. And so I think about 10 to 15% of people in the US are definitely deficient. And it varies because really one of the best forms of magnesium, like most concentrated, is like a cooked cup of magnesium, sorry, a cup of spinach has around 154 milligrams of magnesium, but a lot of people can't eat that because they have kidney stones or they have issues with oxalate or they have issues with gout and it flares up. So unless you're eating leafy greens, nuts, and meats, etc., that are high in magnesium, it's hard to get that in a diet. And so with especially with children, a lot of times children eat only a certain thing. There's some so-called picky eaters, or they'll eat the body weight in just dairy. And so a lot of them are deficient. And a lot of them end up having like issues with just restless legs, or there's fidgety. And so I think diet's always the best. The other thing is, unfortunately, our soil is just different because there's an overuse of fertilizers. So there's a lot of soil erosion. And what that means is when whatever plant material you're eating doesn't get the nutrients it needs. So it doesn't have what it used to maybe 50 years ago. We're using a lot of herbicides and pesticides. And so the topsoil, like there's a lot of deficiencies, and that's part of it too, particularly if you're getting most of your magnesium or your other things through just purely food. And a lot of times we can get like potassium in easily because people will eventually, a lot of people love potatoes, and that's always easy. And magnesium and potassium is a little bit easier with green leafies, but it's hard. And then you can always supplement with other things like nuts and other things, but it's harder for magnesium, particularly if you also are on like if you're diabetic and you're on a medication like metformin, or you're on insulin, or you're an asthmatic and you're using your inhaler 4 times a day, and you sometimes just there's a redistribution issue as well where you lose through other ways. And if you also have like a inflammatory bowel disease that's not controlled, or you have high output from your colostomy, like just if you're losing or having insensible losses, or your water pill regimen has been amped up, it's going to be really hard to keep up with that.
Yep.
So
Yep.
sometimes supplementation, I think, in those cases is important.
Yeah, no, absolutely. I think, and that covers a lot of people, right? That's a lot of the population
Yeah.
that you just
And I
described.
think the problem with magnesium is a lot of times the cheapest form is not always the best form. So there's a lot of magnesium citrate, and there's like magnesium oxide, which if you're having diarrhea and that's the reason why you're having deficiency, it's really hard. And then there's a lot of patients on chemo that just can't, or they won't eat, or they can't eat, or they ate really well yesterday and today is just not a great day. And so supplementation and just hydration, I think, is really important in those days.
What forms of magnesium do you recommend to most people?
I like magnesium glycinate because it's in its kind of amino acid form. I just think it works a lot better. I also use malate, a little bit of malate for muscle cramps in our supplement, but the majority of it is glycinate. We've got like around 125 milligrams of magnesium glycinate. And I think it also, a lot of people suffer from headaches, and I think it just helps with things like little things that you can actually control to some degree.
Great. Magnesium, it's one of those supplements that I have most of my patients taking, if it's, as long as they don't have
Yeah,
contraindications, because it's
yeah.
such a critical nutrient. And like you said, many of us just don't get enough, either because we're not able to eat enough foods that are magnesium rich, or maybe they're on medications, or the soil, like you said, is depleted of many of these nutrients. So even if you're eating a lot of those quote unquote, healthy foods, you still
Yeah,
might not be getting enough nutrients because of the soil depletion.
yeah, exactly. Yeah, yeah. And this is, I think people are starting to recognize this, but it's just a lot of times when someone's potassium isn't coming up, and I think definitely because you end up getting these horse pills, and they're really hard for people to take. I think a lot of times at that point, if there is an issue with potassium, always just get into habit of maybe checking magnesium, because a lot of times it won't come up until the magnesium is replaced.
Yeah, that's so interesting. Yeah. And so shifting gears a bit, one of the things that we speak about a lot when it comes to sleep is circadian rhythm and sort of,
Yes.
fluctuations across the day. So how does hydration status fluctuate across the 24-hour cycle, and what role might that play in sleep continuity?
So I think hydration's well, it really depends on what kind of shift work. Like if people are doing shift work, etc., like what happens. But a lot of times the best time to really hydrate, and we're not talking coffee, because that's what we don't go for, like that first cup coffee just hits like just beautifully. But the first thing you really should do is just get some water, even if you add a tiny bit of pink Himalayan sea salt to it, just to get some minerals in there. Just, I think it's really important because you've been sleeping and I think it's so important. And I think it really depends how you hydrate. So there are a lot of people that hydrate throughout the day and they have these big bottles and they've got like little indicators, and that's great. But a lot of people actually find going to the bathroom at work impractical. And these are the people that literally will camel it all day. And when they get home, they're chugging water because they're so thirsty, or they're not realizing that they're thirsty. So I think it's a lot of people, like I think it's statistics are like 70% of people are dehydrated, and we're not talking severe, we're talking mild. And so a lot of times they're thirsty, but they suppress their thirst because the body's really good at telling you what you need, but you can override it. And sometimes a lot of people start salt craving. And so they'll get home and they'll eat pretzels and they'll overeat. And all they really needed was some fluid. And obviously, and then you get into a situation where you're drinking late into the night and then you're waking up at night to void. And that's really inconvenient. And then people aren't sleeping. So it's kind of like, yeah, it depends on your level of activity as well. So obviously extremes of heat, whether you're active, whether you're outdoors, like playing tennis when it's 80 degrees hits differently than if it was a little bit like it was like 30 degrees. And then the other thing people don't realize is like even cold can cause, so we have a natural, our body tries to keep a natural core temperature. So even if you're on vacation skiing, with the humidity and high altitude and just the cold, you get something called cold diuresis, where you actually lose urine fluids, essentially electrolytes. And so a lot of people are like, I just need to pee when it's cold. And it's a real phenomena. So these are things that people don't realize. So if you're outside and say you're walking, you just have to be mindful. Like, and a lot of us don't drink when we're thirsty. We just kind of wait and we'll drink in a minute. There are some naturally really amazing people that are really good with hydration. And then there's always a risk of overdoing it with water too.
Yeah, and then I'm wondering too for those people who are drinking water in the evening, drinking
Yes.
fluids in the evening, and then they wake up having to use the bathroom. Aside from just the timing of intake of those fluids, are there other aspects with regard to electrolyte balances that might be contributing to those episodes of waking up at night to pee?
There is a link between low potassium and frequent urination. It's not a huge link, but there is a small correlation. And there was a study done. So we normally place people on like a salt restriction of less than 2,000 milligrams a day. It used to be more severe, probably like in the 1980s. I think it was less than 1,500. And the patient and this patient population who was doing less than 1,500, they were peeing because they weren't really, the low salt diet was actually negative to ADH. It was just causing issues with ADH, and they were just kind of had this negative feedback. So they would be waking up to pee. And so that's the other thing. Like if you're eating like foods that are kind of in the summer months, which are maybe not as heavily salted, or you're eating a lighter meal, you've got to make sure that there's a little bit of salt because you probably will need to pee if it's all just fluid.
You had mentioned that some forms of electrolytes are better absorbed than others.
Yeah.
So are there specific formulations that optimize absorption and then help with stabilizing hydration status and sleep?
Yeah, I mean, I think powder is pretty good. There's a lot of different ones. I think there's a lot of different ways you can take electrolytes. There's like chewables, there's like little pills, and there's like little salt sticks almost. And I think it's individual, but I think for optimal electrolyte absorption, you really need, especially like if you're talking about B vitamins, they have to be in their pro forms. And a lot of even the magnesium, you don't want to take a type of magnesium, it's going to cause issues with diarrhea. You don't want magnesium oxide or citrate if you're already having issues with absorption, because you're just going to end up just making things a lot worse. But I think I'll give you an example. There are a lot of electrolyte supplements out there that have like 180% B vitamins or too much salt. And I'm not like opposed to salt, but I think a lot of times if you're having like over a gram of salt, unless you're doing something like ultra, or it's because most of us will get the salt from our diet. The typical American diet is very salty. That will create like a lot of thirst. And I think formulations you don't want anything that's like over 100%. And a lot of times there's also a lot of niacin in these electrolyte supplements, which in really high quantities will cause issues with like flushing. People have had chest pain from it. So you don't want something that negates the whole point of taking an electrolyte supplement. I don't know if that answered.
Yeah, that's really helpful. And then I'm also wondering about sometimes people will ask me about caffeine. If they're drinking a lot of coffee, and of course that has diuretic properties as well.
Yeah.
How might that influence electrolyte status? And then alcohol. They might use caffeine
Yeah.
during the day and then alcohol at night. What's
Yeah.
that doing to their electrolyte status?
No, it's a great question. Caffeine's an interesting one because it's like a legal drug. And so I think the upper limit of normal per FDA is like 400 milligrams. But if you actually look at a lot of these caffeinated energy drinks, you can get upwards of 600 milligrams. So the problem with, so a lot of people will get like, or they may not even recognize they might be having palpitations, getting more anxious, just not feeling great. And the other interesting thing about caffeine is that it's got a half-life of about 6 hours. So if you took like 600 milligrams of caffeine at 2 p.m. because you're so tired, you're only going to go down to 200 milligrams by like 8 p.m. And then by 2 a.m., you're down to 100. So in the morning, you still got caffeine in your system. And I don't think people understand that. And caffeine also does act like it's a mild diuretic, but in higher amounts, particularly 400 milligrams upwards, it does act like a diuretic, and it does cause potassium loss as well. And then I think the other thing and it also causes a rise in cortisol. So people don't realize this. I mean, a lot of times patients will tell them, please don't have your morning coffee when you come in the morning to clinic, because you can tell the ones that are over caffeinated in the mornings because their blood pressure is definitely high. And a lot of our patients will bring logs. And so that it's a little higher than it normally is. So these are all things, I mean, I'm not opposed to it, but I think also you have to be really careful with just generally just energy drinks, because there's a lot of taurine, and I mean, caffeine itself it gives a great hit. I mean, it's very like dopamine receptors are on, and then you've got other issues which cause major mayhem in the body as well. And then alcohol is also, it's an interesting one because it does act like a diuretic because it causes issues with the ADH, and you get this diuretic effect, and you can get very profoundly dehydrated. And alcohol is also like a neurotoxin, and I'm not opposed to alcohol, but like just we're talking about it. And then the other thing with alcohol is, the kind of hangover feel that you get, a lot of it's to do with electrolyte disturbances, because it's partly you lose it because of diuretic effect, but you also get magnesium just not kind of getting taken out of the cells, and just kind of the free pool is low, let's put it that way. And so people get a lot of cramping, they don't feel good, they've got really bad headache. And then you also have things like congeners in there that are like the byproduct of the fermentation process, and that can really wreak havoc, cause inflammation. And then a lot of alcohol has a lot of sugar in it, so people tend to feel pretty bad. And I think there's also an issue with just heartbeat variability. So a lot of times if you drink a glass of wine, your heart rate actually will go up by 5 beats. And obviously it varies in different people depending on like your metabolism, but it can take about 5 days for your body to recover from that. So you get a lot of issues with REM sleep. frequent awakening. And the same with caffeine, but alcohol, I think, and a lot of people get flushing with alcohol, so they get very hot and just a lot of dysregulation, which is never great for sleep.
I think a lot of people listening can probably relate to some of those effects.
Hmm.
So I have lots of patients who tell me that they feel thirsty no matter how much water they're drinking during the day. How
Hmm.
might you counsel someone who's complaining of that?
So, a couple of things. That's a good question. I think the thing with water is like, first of all, a lot of times we have to look at our diet. We sometimes don't realize how much salt we're eating, like a bag of chips or a pickle or like condiments like mustard, tomato ketchup, and spices can make you feel quite thirsty. And I think if all those things are checked out, a lot of times I always tell patients sometimes you need electrolytes and a little bit of salt. Particularly on hotter days, you definitely need a little bit more salt. So the thirst might be real, but you just need to switch up fluids. And a lot of times, even for patients, a couple of my patients get very dehydrated, particularly post chemo. And we often like will give them fluids, but a lot of times the average person doesn't need fluids. I really encourage like broths and soups just to get the fluid in and the nutrients in, because sometimes water doesn't do it. And if it's not that and you're just having issues with you're not making as much saliva, then that's something you need to see your primary provider for, just in case there's some autoimmune issue or something that you're just not realizing is going on. And then I think if it's a persistent issue despite doing just conservative things or just trying to optimize your hydration, I think you need to be seen just to make sure things like thyroid, your blood sugar is okay. And then they're rare, but like you can get things like diabetes insipidus where you're just not able to concentrate the urine. And I've got a couple of patients who are on like long-term lithium that have issues with concentrating urine, and they just are like they can drink 5 liters and they'll just not be able to conserve it. So there are medications that can really help if within the situation. So I think there's a time where you just have to make sure it's nothing else.
Excellent. That's so helpful. Thank you. Are there any other tips that you'd like to share with the audience, or maybe anything with regards to sleep that you find helpful for yourself or for your patients?
For me, like I think because I have two little, they're not little anymore, but kids, and I find sleep has to be kind of like a ritual. There has to be a routine to it. I actually cut fluids off for my kids at 6 p.m. Unless it's like summer months or something like that. I'm not that rigid. And then we have her either like a warm bath, and then sometimes I'll even like do lavender. I think it's wonderful, like a good lavender massage, particularly if they're like sick. I think it works really well. And then sometimes I will do, my kids love it. We do yoga nidra. It's just, I mean, I think it's great. And a lot of times they're snoring. And sometimes I pretend sleeping and I'm like snoring as well. So we just kind of do it either on YouTube or I will just make up my own version of it, a shortened version. And just, I think the major thing before sleep is you don't want huge stimulation, I think.
Fabulous. Yeah, those are all such great tips. Yoga Nidra is wonderful, and lavender and cutting off fluids. And do you have a personal cutoff time? And tell me if that's too personal, but for fluids, what do you recommend for the adults?
It depends, right? So if you go to bed later, I think 4 hours before, but if you're chugging like a big vat or something, it's not going to work. The sad thing is, as we get older, our ADH levels fall. And especially when women are aging, whether they're going through perimenopause, menopause, and then men as well, like it just goes down. So there have been some studies where, it's especially in the neurology population where they were giving vasopressin, but it caused such electrolyte issues, particularly sodium, and because they didn't know how often to test. And so it just wasn't really appropriate to use, but people love it. And that's why kids can lie on their front, sleep for 12 hours, not wake up. And whereas if we drink even like an 8 ounce glass of fluids just before bedtime, we're going to get up. That's part of it, unfortunately.
Yes. Well, thank you so much for all of this information. I think these are really practical and useful takeaways from today. And for anyone who's interested in learning more about Dr. Raindrop, can you tell us where to find it? You mentioned Amazon, but where else can we find you? Yeah,
Yeah, so we're on Instagram and it's Dr. Raindrop one. That's our handle, Dr. Raindrop one. Yeah.
perfect. Wonderful.
Yeah. And
Well,
I'll link you to our website and things like that. Yeah.
I like the little videos that you have sometimes on your Instagram showing how to make mocktails using
Um,
the product. Those are really fun.
Thank you. Thanks so much. Thank you for doing this. I've really enjoyed it.
Oh, thank you for coming on. And I'll put all of the links to Dr. Raindrop in the video description below. So for anyone listening, you can go and check out those links. Thank you again. I really appreciate your time.
Thank you so much.